My name is Chantal J. I'm a licensed psychologist with Duke in the Department of Psychiatry, as well as with the Duke Center for Eating Disorders. I treat specifically, I'll treat anorexia, bulimia, binge eating disorder, as well as disorders that don't necessarily fit within the criteria for an eating disorder, like orthorexia. These are things where people are hyper-focused on health. I also treat, there's atypical anorexia. These are folks that are experiencing restriction but might not be within the weight that is required for the DSM-5. What's really special about Duke Health, specifically the Duke Center for Eating Disorders, is number one, that it's actually a really small center. It's a clinic outpatient center with many different providers working together. We're a small team, so we know each other all really well. Some people have been working with each other for 20 years. And so there's that really special relationship that we have that not a lot of centers, especially with big hospitals, really get. At the same time, our center, especially with our director, does a lot of research, and so we're using some of the newest evidence-based materials for eating disorders coming right from our own research, and it's really cool to be able to implement it straight from there into our clinic. I love connecting with people in general. It's funny, I consider myself an extroverted introvert. And when I meet people in therapy, it's just amazing to see people come out of their shell, but also to watch them grow. I think the most gratifying part is seeing people get better, especially with an eating disorder. The eating disorder tends to numb out a personality. And when you see that personality come out, it's amazing.